We all know the latest COVID variant Omicron is highly transmissible. Now, this is the latest data from WHO. It's a bit lagging. Then we have the data from CDC. In this video, I'm going to discuss with you what to do if you're exposed to COVID, the latest guidelines, when to get tested. Now, exposure to COVID seems inevitable at this point. Welcome. I'm Dr. Zoraz Khan. So you're exposed to COVID. Now, either you will get symptoms or no symptoms, or maybe not yet. Now, we have CDC guidelines you can find on cdc.gov. Now, you can keep scrolling. Quite elaborate. Now, the CDC has been going back and forth with the guidelines, but made some updates a few days back after facing backlash from several medical experts, including the former Surgeon General. Now, they're, let's say, more palatable, which we will discuss. Now, this is my personal algorithm, and this is what most physicians typically follow and can be tweaked around. So let's start. Exposed. Now, if you have symptoms, isolate for 10 days. Remember, you are still able to spread the infectious virus for up to 10 days, demonstrated in various published studies, maybe longer for severe disease. Now, per CDC, the rule is 5 and 5. That is, isolate for 5 days. And the next 5 days, you can be around people with mask if mildly symptomatic. Now, for sicker patients, it is still 10 days. Now, testing. First, do an antigen test. It has a very low false positive rate, by the way, especially if you do it the right way. And given the current COVID wave, in the presence of symptoms, consider a positive antigen test to be a positive. It is important to risk stratify. Do you have any of these conditions, or do you live with somebody with these, or work with people who are high risk? The best practice would be to confirm with PCR test, but not necessary. Now, what if your antigen test is negative? Then we do a PCR. And also keep in mind your physician may check for other pathogens like influenza, which is making a comeback, and also RSV, which we have had for a few months now. If your PCR is negative and you have moderate to severe symptoms, repeat the PCR in 24 hours. Now, what to do if the PCR antigen test is positive? Now, based on the risk factors and severity of symptoms, we have some treatment options as listed. The window for antivirals is within 5 days from onset of symptoms and less than 10 days for monoclonal antibodies. Not everybody needs these. These are for people who are high risk. Now, if you do not have symptoms, per CDC, quarantine for 5 days and then monitor 5 more days wearing a well-fitted mask or an N95 mask around people. Day 0 being your last day of exposure. But if you're living with a family member with COVID, here's what I have to say: quarantine for 10 days. Now, for return to work or school, you have to get a test 24 hours prior to return date. Individuals who are immunocompromised need to get tested early so you don't miss the treatment window. Now, this right here is when you can opt out of testing. You are not high risk, not living with immunosuppressed individual, not having symptoms or mild symptoms, work from home, but again, quarantine for the right amount of time. Now, the CDC has guidelines separate for the healthcare personnel. You can see the no work restrictions here and here, understandable, given these are contingency and crisis strategies in the setting of health worker shortage in an ongoing pandemic, and we are the frontliners. Again, there are very lengthy pages on the CDC website, and this is a simplified version. High-risk exposure is not wearing proper PPE or personal protective equipment, which includes eye protection, and at least 15 minutes exposure to a COVID-positive person. Now, different protocols for vaccinated versus unvaccinated are not fully vaccinated, which is 3 doses. Now, for the vaccinated, keep working as long as they're a negative test on day 2, 5, and 7. Now, for the ones who are not fully vaccinated, quarantine for 7 days with negative tests within 48 hours of return date, and provided they are symptom-free, or just 10 days with or without testing. For the ones who have positive tests, either you have symptoms or no symptoms. Now, symptoms could be mild to moderate. Moderate being when they're involving the lower respiratory tract. Severe is when there's hypoxia and hospitalization. Now, for mild to moderate, isolate for 7 days with negative test 24 hours prior to return date, or 10 days with or without testing. Now, for severe cases, return to work after 20 days after symptom onset, and also if you are free for 24 hours. Now, if moderate to severely immunocompromised, discuss with your infectious disease physician. Now, for the ones who do not have symptoms, return to work after 2 negative antigen or PCR tests 24 hours apart. All right, now for my fellow healthcare workers, I feel for you guys. The hospitals are flooded. Although the studies have shown that the Omicron variant is less severe, but because of the high transmission, the sheer volume is stressing out the hospitals, which are understaffed. Look at these numbers right here. There are currently over 142,000 people admitted here in the US with COVID. Now, incidental or not, the future studies will tell us about the correlation. Remember, the hospitalizations lag behind cases and the deaths lag behind hospitalizations. We are all hoping for the situation to improve in the next few weeks. Meanwhile, follow these guidelines and use these. Stay safe.